Most people tend to get symptoms when they're over 50. It's a bit more common in men than women, but some people can start to get symptoms in their 40s. A reduced sense of smell, depression, anxiety, tiredness, problems with sleep, constipation. It's a reminder to keep an eye on what's going on with your body, because there are many causes of those things. Of course, it doesn't have to be Parkinson's, but checking in with your doctor regularly and keeping an eye on your health is really important. But there isn't a test, there isn't a particular blood test you can do to look for Parkinson's, which is one of the reasons it's hard to diagnose. But as it progresses, symptoms might be a bit more recognisable. Slowness of movement is probably the first one. People slow down. Tremors, particularly in the hands, very common. Stiffness and difficulty initiating movement, tiredness and exhaustion and fatigue, and smaller handwriting reflects a lot of changes in the brain. If you're worried about any of those things, maybe if you've got a bit of a family history, talk to your GP. I qualified in the 2000s, and the drugs were really the emphasis. There was sort of a handful of drugs or a couple of drugs that really make a difference, and that was where we focused. But increasingly, we have great research on exercise. And Nick, I mean, you've talked about this, but can you just sort of say what it's done for your dad and what you've seen in things like the boxing gym?
So I know that on days when he has someone who helps him do some exercises, he says that they are a day when his tremor is less bad afterwards. And on top of that, he sees a significant improvement in his handwriting.
One of the things that people use is if you're doing boxing, then as your movements become difficult later on, you're in the supermarket, you can think about that boxing to reach for things. And you also seem to get these anti-inflammatory effects, which early research, looking at animal models, there may be some indication that exercise might slow down the process of the disease itself. Parkinson's UK, they've kind of got a search tool to look for a sports club or a class, different initiatives going on around the country. So really, I'd encourage people to try and get those specific benefits.